Hello, and welcome to this episode of Little Bits of Stuff, a podcast that showcases different health related topics for medical professionals and non medical audiences. This show is brought to you by Nick Ate, a surgical resident at University College Hospital, Ibadan, Nigeria. And here's your host, Nick.
So, oftentimes you hear ladies say they were pregnant and they still saw their periods for some months. Others say they saw their periods the very first month and it stopped. And others even say they saw their periods stopped and then later on they also saw the periods start again. The real question here is it possible to be pregnant and still see your periods? That and more after I introduce my guest today. Actually, I don't want to call her a guest. I prefer to call her more of a co-host. Meet Dr. RB, Dr. Rose Ben. Can you say something for the house, please?
Hi, Dr. Nick.
It's nice
am
to
I
have
meant
you
to be
here
introducing
today.
myself, or I should let you do the honors?
I think you should introduce yourself.
Okay, I'm Rose Ben. I am. Let's just stick with Dr. RB for this podcast.
Okay.
I'm a house officer that's an intern in the University College Hospital.
Mm-hmm.
Currently, Dr. Nick is my boss.
You didn't have to say that.
For the next
actually.
10 days, I think.
You didn't have to say that.
So I'm Igbo,
Okay.
Catholic, because I was actually asked to put this out there. I'm a writer, poet, and a public speaker. That's all. And I know 2 languages.
That can be all now. You also told us, a while ago that she was the first female Senate president
Oh my
ever.
goodness. They had to bring this up.
That's some record. You have to tell us about that. That's some record.
Well, that's a record in medical school. We're back to, real world. We're humble citizens of the University College Hospital, Ibadan and Nigeria.
So no more politics. You just want to dump everything.
I didn't say no more politics. I'm just saying that that's like in the political past to be used in the political future, but not in the present.
Okay, that's fine then. Well, I think that's cool. Yeah. So the topic of today, I didn't know I was pregnant. Has had several myths, there's several rumors everywhere. There are several complaints. A lot of women are confused. A lot of times you have people going to their doctors, and some don't go to their doctors. They just assume a lot of things. And at the end of the day, the question, persists, goes on. Can you really be pregnant and still have your periods? What do you think, Dr. RB?
I think you should add one more very important part that women go to. They go to their friends.
Oh, okay, yeah.
Yes.
Yeah.
So you tell your friend, I think I'm pregnant, but I'm seeing my period.
Mm-hmm.
And it's like, were you trying to get pregnant? Yes or no? Yeah. Well,
that also depends on if, she was married or not.
oh, please. Let's just say, were you trying to get pregnant? Yeah, baby mamas, Dr. Nick. You're aware of those, right?
Well, true.
So,
True.
well, there's the pregnancy hook to marriage. So, are you trying to get pregnant? This question. They're like, sort of, kind of, not really, maybe, or no. And then it's like, but I think I'm pregnant. I'm adding weight. I'm having like heartburn, but I'm still seeing my period. And it's like, did you do a pregnancy test? It could be yes. It could be no.
Okay.
Yes, I did. It was negative. I'm still seeing my period.
Oh.
So it's you just and at the same time, the person is still pregnant. So it's still possible actually. It's possible for the one to be pregnant, for a woman to be pregnant and still see her period and have all these questions that she doesn't know how to give answers to. So
Yeah.
it's possible.
Oh, well. There are a lot of reasons why you could still see what may look like a period during your while you're pregnant. The thing is this: a lot of times, we try to demystify things like this and get a lot of people even more confused with, things we say in the medical world and all that. Right here today, we're going to use the very simple terms that you can understand. We're going to try to, as much as possible, demystify and give you some little bits of information you can work with. The real truth is, while pregnant, you should not have your periods.
True.
On a very good day, you should not have your periods. Now, there are several reasons why you may see blood while pregnant, and some of them are very simple things which you may just think there's really no big deal about this, and for some of them you really need to run to the hospital. We'll talk about two common reasons why you may see blood while pregnant, and but before we talk about that, let's talk about what really happens on a very good day. So your period occurs every month, although I still don't I still don't envy you guys.
Don't worry, we got it.
For you to just bleed every month, I mean, you just literally bleed every month.
Like I said, we got it.
I think
it's part of the experience.
Part of the punishment, for a lot of.
Excuse you. I will not. I'm not even going to dignify that with a proper response. Just moving along.
And I also like the fact that you guys have some cramps, just to follow
Dr.
through.
Nick, you'd be surprised at the number of people that will troll you on social media, and you would realize that we know your house address. Number 5, layout, street, airport road. That's where he lives.
well, you can still come look for me on social media. I'll be happy to receive you there. Okay. So the period has to come every month. Okay, and especially when your eggs aren't getting fertilized, you bleed. Just to shed away, just to shed all those. Let's get into that again.
Okay, and then I just want to point out something to ladies. Like the normal period is 28 days plus or minus 7 days.
Yeah.
So people sometimes just ask, "Oh, hi, I have a doctor friend and my period is 32 days and I think it's too long." So normal 28 plus or minus 7. So that's 21 to 35 days.
Yeah.
So just to point that out while we are going along, so that if your period goes from 30 days to 25, don't say, "Oh, I think it's early signs of bleeding and I'm pregnant."
Well, yeah, true. Anyway, true. So usually the normal period starts off light for most people. Starts off light and then it gets heavier. And then I think it drops again after some days.
Lightens out again.
And then, so you use a pad the first day, the second, third, fourth day. Dr. RB is using 4 pads.
Oh, Lord have mercy. I am a proud woman who, we have been going unashamed. If you've been like Acido and all the other foundations that go unashamed. So, yes, thank you. We are women. We menstruate. It is normal.
Yeah. It's fine.
I'll keep Dr. Nick out of my head. People have different cycles. Some people start off heavy on the first day and it just lightens out. Some people start really light and then day 2, day 3, it's heavy. Day 4, day 5, it lightens out. Some people, it's just 3 days of a period and not 3 days seem to be heavy. But they always say, okay, second day is heaviest and then it just lightens out. So it depends. Different physiologies, different bodies, different experiences.
But on a lighter note, I just got yours right. That's why you wanted to eat me raw, right?
Actually, you were so off. Oh my goodness. I can't even tell you how off you were, but
oh god. Yeah, so some people, people still claimed it. I think they have these claims. I think they started a TV show. I didn't know I was pregnant.
Yeah, very interesting.
I never saw any episode.
Oh my goodness.
It was a series, right?
It's not like exactly a series, but they did it in, I don't know how to call it. Maybe I'll say it was in a series, but I just know I used to enjoy watching those episodes. Like I'd stay up late just to watch them.
Mm-hmm.
They were very interesting. When I was still in love with ONG, so I just stay awake watching. I wasn't in medical school yet. I just liked it.
Okay, okay. So these particular bleeds that we were talking about today, the reasons why you could actually have some bleeding even while you're pregnant or after getting pregnant. Um, these particular bleeds usually have some little differences from what your normal period should look like. We'll be pointing out these differences to you today. Um, well, one of the two things, very common ones, is one, if you have an implantation bleeding. Secondly, if you have a decidual bleeding. And then there are a whole lot of other reasons why you may actually have some bleeding after you get pregnant, which would also just mention, before the show ends today. Now, for implantation bleeding, you have it happens during the initial stage of pregnancy, and you may not even know you're pregnant at that point. And it happens when the fertilized egg tries to implant into the lining of your uterus, and at this point you may have some bleeding, which will just be like a mild spotting or just a light bleed. It usually lasts for about 24 to 48 hours, and usually the first month of the pregnancy, and that's all. It occurs in about 25% of pregnancies, so it's not like everybody should have an implantation bleeding on a very good day, or some may even have it, and it may be so mild that you may not even notice. So it's fairly common for 25%, but really not that common for everybody.
Okay, so I think what you want to 25% means like 1 in 4 women will have it.
Yeah.
So it's usually different from what you've seen in normal period, but some women confuse it with their period, so they'll complain, my period was way lighter. It wasn't the normal red blood I'm used to seeing. It was really altered, brownish. So that gives you a hint that, okay, it was probably not your usual period, and it could have been an implantation bleed. And ladies, if you are sexually active and you are not having protected sex and you are not on any contraceptive form of contraception or type of family planning, and you experience that, then you should either take a home pregnancy test, but at the same time, there can be a false negative, or go see your doctor so that you can rule it out, so you know that it's not something more serious, which we will still discuss. But for implantation bleeds, like I said, it lasts like 24 hours, 48 hours. So you just think, if it's usually confusing for those who have periods of like 3 days. So they see bleeding for 24 hours, 48 hours, and they're like, this is one of those months my period was lighter. Meanwhile, it's actually an implantation bleed, and you are pregnant, and you have to be careful, because during pregnancy, there's certain do's and don'ts that may be discussed in a later segment. If I'm nice enough to Dr. Nick to come back.
We'll see about that. So, just as a very little clarification on the timeline, take it this way. The first day or day 1 of your menstrual cycle, you see your menstrual period, day 14, 16, ovulation occurs. Of course, just like Dr. RB explained, we're talking about the typical 28-day cycle,
Yes.
Yeah, so the 14 to 16, ovulation occurs. The 18 to 20, if you're sexually active like Dr. RB, you see
right? You forgot to add Dr. RB said. Okay, I just want to clarify. He meant Dr. RB said. Okay.
Yeah, so the 18 to 20 fertilization occurs, and the 24 to 26 thereabout, you may have an implantation bleeding, which may just happen for 2 days or 7 days, depending on maybe individual differences. Anyway, so there are several differences. Dr. RB just mentioned some differences between your normal periods and what may actually be an implantation bleed. And you mentioned brownish, some may be brownish
Little,
color.
usually
Yeah.
less. The quantity is usually less.
Is usually less. Some just a few drops of blood. 1 to 2 days maximum. And of course, some of the reasons why, part of the reason why it's confusing is because it may also come with cramps.
Yes, true.
It may
Very
also come
mild.
with cramps, some frequent urination, nausea, and all those little things ladies crave during.
Just put it as the perimenopausal syndrome. So, ladies, it could actually be like,
yeah,
not everyone knows, but some people know what like comes around, or those things associated with being on their period. So some say, oh, I crave this, I can't stand that, I can't stand sugar, I have cramps with this. And this bleed may then come with some of those symptoms. So it's confusing. Are you pregnant, or is this just a normal period? Since you have very mild cramps, if you're someone that has cramps normally, you have something like a form of it and a bleed that looks like your period.
Yeah.
You sum it up and say, it's my period. Not realizing that, okay, this may not be the period, and this is the first few days. Actually, funny enough, it's the first few days of pregnancy.
So, moving on, that's implantation bleed for you. Moving on, decidual bleeding. Decidual bleeding is even the one that is even more confusing for a lot of women, because they tend to spot, longer than the implantation bleed, and it's just as a result of some hormonal imbalance during pregnancy. So a lot of women bleed because it just means the shedding of the lining of the uterus. So a lot of people just bleed, especially during the first 10 weeks, and then they may stop after then. Again, these things are individualized, and this even goes as far as affecting how to calculate the expected delivery date, gestational age, and all that, unless you go by way of ultrasound and things like that.
And that was if it was an early ultrasound.
If it was an early ultrasound, very correct. So so a lot of times it's the major reason, I think, that some women complain or say that they saw their periods, and some may actually first have a decidual bleed, and then later on that stops, and they have some other late trimester kind of bleeding, which will make them to say they had their periods all through their pregnancy. But some women or some people don't actually pay a lot of attention to details about how their periods occur, and the things how heavy their flow is, and the differences between what they saw and things like that. I mean, if you say like 10 pregnant women and you ask them what their cycle length is, what's your cycle length, Dr. RJ?
Why do you want to know?
Because I just wanted to prove to my audience that a lot of
you're not.
a lot of people don't even pay attention to how long their cycle length is.
Yes.
And how long. If you listen to my menstrual cramps, why women have menstrual cramps, I think what women want to know episode, we talked about extensively about menstrual cramps, why women have menstrual cramps, and how you can also monitor your menstrual period, and things like that. So you can go check it out, and then you'll come back to listen to this one. So a lot of times, if you pay a lot of attention to your body, pay attention to your periods, you may be able to say at what point you started having these differences, and then you may be able to tell your doctor what he really needs to know, so that he can attend to you efficiently.
Okay, and I would just say, ladies know that how your period started when you were a teenager and how it evolves to when you're a young woman, it changes. So if you actually pay attention to it, you will notice these changes. Now, it's not only for many people, it's like when you get married and or you want to try for a child, then you say, okay, let me start paying attention. It actually starts from early on. Because if you have monitored, and I don't mean crazy obsessive monitoring, but if you have monitored your periods, which is a very vital part of your life anyway, if you have monitored it for quite a while, there's a way you can tell your pattern. You know that, okay, maybe my period is not the 28th day on the dot type of cycle. Maybe I fluctuate between 26 days and 30 days throughout the year, which is very normal. Many people don't realize that. If you've paid attention to all these details, and when you become sexually active and you have any of these types of bleeds, that's the implantation or the decidual bleed, you'll be able to tell the difference. That it seems like this is lighter than my normal period. It doesn't last as long, and I know for the past 2 years my period lasts 4 days. It lightens up at this point, but for maybe decidual bleeding, you notice that it lasts like 2 to 3 days. It's lighter than normal. The cramps that come with it are not as bad as what I've been having for the past 2 years. And importantly, you have been sexually active at some point, whether or not you use the barrier method or not. Just have it checked out. Let's just be sure it's normal, because we'll talk about other things that could be abnormal, but just be sure it's a variant of normal that decidual bleeding is, but still relatively normal.
Yeah. So I mean, and then if you can't, tell these differences apart, it helps you to know at that point that I need to go see a doctor.
Sure.
Get yourself checked out. There's so many other reasons. You may be having a miscarriage, which occurs usually. You get pregnant, you miss your periods, and then later on you start spotting and all that. That's another different ball game entirely.
Yeah.
Okay, you may also have some cervical infection or cervical ectropions and things like that during pregnancy.
Dr. Nick, you promised to break it down. Break it down. Break it down. What is ectropion? Excuse you.
Well, just some irritation, inflammation, and things like that. So there are a lot of things. And then you mentioned that you've seen a young pregnant woman with cervical cancer.
Yes, very rare, but it can occur. So, ladies, you have pain during sex, bleeding after sex. There's some of, not all of, the symptoms, and that's when you're pregnant. Well, when the person is pregnant, you need to have it checked out. I'm very sure I won't have that. But you get it. When you're pregnant, you need to have it checked out, because even though you're thinking, could it be an infection? Could it be an implantation bleed or a decidual bleed? At the same time, it could actually be cancer of the cervix. So you have to have it checked out. And if that is it and it's caught early, we still maintain it. Cervical cancer is one of the most preventable, treatable cancers in the world. So it could be treated fast and, put the lady's mind at rest. Yeah.
Okay. So apart from this, some people have also said if you have ectopic pregnancies, you could also have some early pregnancy bleeding, although you have some other clear-cut, except it's chronic anyway, but...
Or it's slow leaking ectopic, meaning it hasn't ruptured, but it's just leaking slowly.
But I mean, when it's acute, it's totally an emergency.
It's not going to be a decidual bleed type of blood. Trust me, it's not the one where you'll be saying, my period has been on for the past 3... No.
It's the type they rush you to the hospital.
Honestly, it's the type that it starts and you know that this is a pain I have never felt before
in my life.
It's
you have to add in my life.
In medicine, it's like the thunderclap headache. Yeah. But this is the thunderclap menstrual pain. That you just have to get to a hospital immediately. So that's for ectopics. But at the same time, if it's a slow leaking ectopic, it may not have those classical symptoms, but it's still an ectopic pregnancy. So this is another time where you see bleeding, you really want to be evaluated by a doctor. And get to a doctor before we start saying get to a specialist. Get to a doctor. Any doctor worth his salt would always want to have an ultrasound scan done to know that what his or her salt. I'm sorry, don't let me be like the Nigerians. What her salt? You know, we said women should see women. What his or her salt would want an ultrasound scan done to know or to ensure, okay, this pregnancy is within the womb where it's meant to be and not in any of the other places it could be if it's not in the womb. And to be sure that there's nothing else going on that you should be suspecting. To even ensure that pregnancy is viable. Because there's pregnancy and there's pregnancy. Let's not use a worry to say, if you get belly, and you fit get belly. So, you know, like there are two pregnancies. You could be pregnant and it's not a viable pregnancy and it needs to be removed. So you don't go through emotional upheaval when it's now, when the body wants to take care of it itself. So any doctor, what his or herself would say, oh, there's bleeding, I want to have an ultrasound scan and a number of other tests done. But first, usually an ultrasound just to rule things out.
Yeah. Okay, so I think we've overflogged this issue actually.
A little bit,
right?
But can you ever overflog things about women's reproductive health?
You people always have
no,
one
it's not
issue
you people
or the
because
other.
By the time you marry, before you marry, you know they'll have been shouting wife material 1,000 yards, and the typical Yoruba Dr. Ates people's response is after 9 months, I'm a great. How do you say that they will carry twins? Yawo abi beji. I know we used to sing that song very well. Yawo abi beji. Bolo atife. Yeah. So it's important to talk about it because even though now we're getting more enlightened in the world and knowing that infertility can be, and sometimes a lot of times it can be the guy's fault or from the guy. No one is at fault. Can be from the guy's part. So it's important to overflog it. In fact, you haven't overflogged this enough. This horse is still standing. We'll flog it some more later.
Yeah. So, but you know, that's just a way to say enough of the beating, right? And
a bit.
Yeah. And so, for ladies, if you're pregnant and you're spotting, check a doctor. See a doctor. If you don't know if you're pregnant or not, even if you're using, some people are on oral contraceptives or on contraceptives generally.
Even intrauterine device, even the ones they put right into the womb.
Yeah, and they could still get pregnant. So whatever it is, you have a vaginal bleed, go see a doctor. Yeah. Don't say, oh, okay, I use protection. Oh, okay, no, I'm on contraceptives.
And don't postpone it. Don't procrastinate that visit.
Yeah, you should go see a doctor as soon as possible.
Yeah.
You may never know what is lurking in the shadows.
And please, Provisio, if you are sexually active,
I don't know why you keep
because you cannot be
on sexual activities.
You cannot be pregnant. You cannot be pregnant if you are sitting in your room by yourself, or you say Bluetooth pregnancy, or you say I went swimming and I got pregnant. So if you're actually sexually active, please, it's not only when you get pregnant you should see your doctor. You should get tested, regular checkups.
Yeah, of course.
You should be protected, but if you're not. And please, we still advocate you get protected. If you say, oh, I'm on the pill, I'm on a hormonal, or I'm on a device, or I'm on an injectable. Do
you think this advocacy for abstinence and all that?
Oh, no, I'm big on advocacy for abstinence. Like, I'm Catholic. I'm pro-life.
I know.
I'm not pro-contraceptives, but my point is...
do you think abstinence is winning? Don't you think protection should actually be...
I think abstinence wins 100%. Because if you're practicing abstinence, there's no sexually transmitted infection.
No, but I mean...
There's no pregnancy. There's no no bleeding until you're married.
No, but
Anyway, let's not go into that argument. Dr. Nick is pro-contraceptives. I'm pro family planning and the natural way abstinence.
I'm pro-protection.
Exactly.
Not necessarily not necessarily what people think contraceptive.
So if you know, I remember the popular advert, zip up. If you know you cannot zip up and you cannot hold body.
A lot of people cannot hold body.
Oh, it's all the thing in your mind. Self-control. But anyway, if you know you can't do that, all right, and you are sexually active as a female, please do not wait until it's too late. Get screened. Please, cervical cancer screening in many centers is free. And if it's not free, it is really cheap. So get screened for it. Is, like we said, the most preventable and treatable cancer in the world. Cervical cancer. And yet, it is the one that kills the most of women in underdeveloped world.
Wow.
Like Nigeria. Please, let's state it, like Nigeria. And it's very sad. And if you, like we're still saying, if you are sexually active and you notice changes in your period, please see a doctor. See a doctor. See a doctor. We are hammering doctor, not the other people that live in your neighborhood.
Yeah.
We will not say beyond that.
Not
see
a
doctor.
Not a patent thing.
Yeah, not the chemist.
Not the chemist.
Not the guy that runs a pharmacy shop and has a shop behind the shop that he does stuff at. So please, please come to a hospital, a proper hospital, get evaluated. If your doctor says, "Oh, go home, you're fine," tell me, sir, with all due respect to your MBBS, and that MBBS is very important.
It's quite
please,
important.
can I have an ultrasound scan done? And when you do your ultrasound, please do it in a proper center.
Oh,
please do it in a proper center. Don't go to any court. Go to a reputable center. Spend that money. Yes, it seems like a lot, but spend it. It's your health.
Yeah.
Health is wealth, but wealth is health too. So
definitely.
just be safe and be good. And I don't know. I'm not sure I would say more than that. Be safe, be good. Spend your money on you.
Yeah.
Don't look for any zaddies, or even if the zaddies something. Spend it on your health. Spend it on your health. It's important.
Yeah. So, okay, guys. Yeah, you heard it all. There's nothing left to say about this. So let's know your feedback, your comments on our social media handles. Let's hear what you think about this, your queries and clarifications. Although you will still go see your doctor, I won't be giving consultations online.
what everybody wants.
Yeah, but you can let us know what you think about this, and we'll definitely answer your questions and your queries and clarifications and contributions, additions, subtractions, whatever you want. And some very interesting episodes coming up. Shooting blanks is one of them.
We're waiting for it.
Yeah, and I don't know. Would you be interested in joining me for that, RB?
Well, let's see how persuasive you can be for the next episode. That's what I'll say. Pride.
Yeah, so shooting blanks. I mean, you hear people saying my withdrawal game is tied. My pull-out game is crazy. 007, the legendary pull-out.
You are the only ATM in Nigeria.
What if you are shooting blanks? That's another thing we'd like to talk about. And for the residency content, a lot of people have been buzzing me and waiting for this. So sorry, we had some challenges, but Thyroid Smackdown Part 2 will be out in a week or two, and we'll definitely have some interesting time. You look out, just watch out for that episode. So it's a wrap for today.
Thank you for having
me in the next episode. Yeah, thank you, Dr. RB, for joining me for this episode. I really appreciate it.
Despite all the shades you threw, I still forgive you. I will go to work tomorrow. By the way, guys, I just want to say that Dr. Nick actually banned me from using the SIR word throughout this episode. Meanwhile, we're going to be done, and we'll pick it up. Like by tomorrow morning.
Tomorrow morning,
we'll be back to saying the SIR word. I can't even pronounce it. There's a ban on the room.
There's a big ban on it. So,
but anyway,
yeah, it's been nice having you here.
Thank you very much. Can I just sign out with this? That ladies, after listening to this, and those of your friends that wouldn't have listened to it, send it to them.
Yeah.
Then the next time they tell you, "Oh, I think I have this issue or that issue, reproductive health issue," send this to them, then refer them to go to a doctor. You could always give them Dr. Nick's number, but oh well, I don't know if he does online consultations. I'm not sure many of us do.
I may do some online consultation with some fee, something for...
He doesn't work for just the money. He loves the populace of Nigeria. So listen to this, send it to your female friends, Send it to your male friends to send it to their female friends. Send it to your sisters, your aunts. Send it to your older aunts who still want to
The
have
whole
a
clan,
baby.
in short.
Yeah, essentially, any female you know, send it to her. And the next time someone asks you for advice about something like this, you have baseline little bits of stuff to share. Thank you.
Bye for now.
Bye.
And that's it on Little Bits of Stuff for today. Please subscribe to our podcast on iTunes or Google Podcast. You can also get it on Audio Mac and YouTube. Follow us on Twitter at Lil Bits of Stuff. That's LILBITSOFSTUFF. And on Instagram at Little Bits of Stuff. That's LITTLE Bits of Stuff. Until next time, stay healthy.